Yeah, I think you're right. So, historically, I don't think really anyone sort of cared about vaccines. It was kind of just one of those things where it is what it is. You go and get it done. I mean, you will have always had the kind of probably 10% of people who are kind of polarized on either side of the kind of argument, and I think COVID sort of brought that out. And I think, for me, I think there's far more controversial areas of healthcare, but the issue with, I guess, vaccinations is that I think people had two issues mainly. One is that you're taking something when you're not ill, and we see this a lot with people who say have high blood pressure or high cholesterol. Often getting someone to comply with their treatment is very different to, say, someone who has pain and you need to take a painkiller. It's a lot more real. I think the issue also for people was this kind of mandate, effectively sort of by proxy. So a lot of people just felt uncomfortable about that kind of approach, but we won't go down that road. I think the important thing for vaccines in general is you have to follow the science, and the thing about kind of vaccines and COVID is that it had this everyday effect where it was something that affected all of our lives every day for a period of time. So everyone had an opinion on it. And there's a very big difference between, you advocating a position versus what the actual true science is. Science isn't, it's not a noun, it's not a single person. It's a process that you kind of go through where you're, constantly evolving, adapting to the science. You're kind of testing the rigors, and actually challenging your, beliefs and preconceptions. There's definitely no absolutes, and we saw that. Anyone who kept the same position at the beginning of COVID-19 to what evolved at the end is not really a true scientist, because the evidence that emerged completely changed. So the position we took at the start was very different in terms of the context, and the decisions that had to be made were very sort of real. Of course, as we've evolved, we're now in a position where no one even talks about COVID-19 anymore. I mean, what's happened to the boosters? Everyone was kind of thinking that we were going to be predestined to having a booster every 6 months a year. You don't hear anything. And that may change, but I guess the goalposts here changed in the sense that people developed immunity, whether it be through the vaccine or natural immunity. And what was interesting actually is that, and this is NIH data, they found that people who had natural immunity through catching the infection versus the vaccine had a lower incidence of hospital admissions. So I think what happened was that people began to realize actually it's not all about just having the vaccine. The fact that pretty much most of the population has now become immune through natural infection, they're probably getting a lot better protection, and I think it's just now fizzled out until the next kind of strain comes along. So, I kind of segued in terms of what I was talking about, but, where can you find the information? I think it's very difficult because, we're now getting into areas of health, not just with kind of vaccine and vaccine selection and timetables and schedules. When it comes to just general health issues that people are presenting with now, which are predominantly lifestyle problems, gut issues, hormonal imbalances, weight management, fatigue, brain fog, this sort of stuff. It's not something that's taught through a regular curriculum, and it's not something that many practitioners are able to sort of talk about sort of confidently or certainly integrate together. So I think on that same point, when it comes to vaccines, I mean, unless you're an immunologist and deal with vaccines, you're probably not going to have a huge amount of information beyond kind of the basic stuff that you can get on a CDC website. Right. So it genuinely is tough. So people are left kind of exposed to this internet world of, again, people advocating certain positions and posting about the downsides to vaccines or complications, and taking certain positions where it's not backed by science. So it becomes very difficult. But I think you see that again in many aspects of health. Nutrition, I mean, everyone has an opinion on nutrition. Everyone seems to have a way of fixing weight loss. It's very nuanced, and I think in general, if you have practitioners who speak in kind of absolute terms and aren't open-minded again to the kind of changes and evolution of the evidence, they're generally probably not the people that you should be speaking to.
And you talked about immunity. How do you build up your natural immunity? Because when we talked at the beginning of COVID, I remember you said, I think the fear might be worse than you said at the beginning of COVID, I think the fear might be worse than the virus.
Yeah.
And good call. It was very bad for some people, but there were a lot of people who were in sort of a poor state to get hit with a COVID or the flu. And so can you talk about that a little bit? How do you naturally boost yourself?
I think that was one of the key points with COVID, in that it shifted people's mindset in the sense that a lot of people were becoming sick who previously didn't consider them sick they weren't sick in a traditional sense. But quite clearly there was a subgroup of people, and it was probably a lot larger than we anticipated, that hadn't had a diagnosis, but clearly there was something about their physiology, whether it be this tendency to being inflamed, whether there was kind of early insulin resistance. We've heard people talking about low vitamin D, low testosterone in men. I think it's ultimately going to be multifactorial, again, all these things. There's no one root cause. I think the answer to boosting your immunity is the same to how do you keep yourself healthy in general. And the 4 pillars are always going to be your nutrition, movement. The interesting thing about movement is the devil's in the dose. You don't want to undermove, but you don't want to overmove. And we see a lot of this in people who already are cerebrally and physically stressed. They're over-exercising, and that's adding to that kind of inflammatory sort of storm. And then a lot's now being said about mental health and stress resilience and sleep. We can't remember sleep, and we've had this conversation before. I think that sleep underpins everything else, in the sense that if you're well slept, you have a lot more leeway in terms of what you can get away with your nutrition and exercise or lack of exercise. It doesn't work the other way around. You're not going to be in good health. And I think people forget that. Everyone focuses on nutrition and exercise, I think, because there's huge commercial industries behind it. It's a lot easier to address. If someone tells you to eat something, it's quite sort of binary. Exercise, you just got to go and do it. When it comes to stress management and sleep optimization, it's a lot harder, given our kind of the issues are our modern day lifestyle, which is very difficult to adjust.
I thought it was interesting in COVID because the UAE was one of the only countries where the medical officer of health came out and said, get your vitamin D up, get your vitamin D tested, and get it up. And they weren't saying that in other parts of the world for whatever reason, but I found it telling.
Yeah, there was definitely an association. Although actually I think interestingly that I don't think the studies showed that much with people supplementing with vitamin D and outcomes. It was certainly observed that a lot of the people on with severe medical complications or on the high dependency units had low vitamin D. But I think that's more a proxy for sunlight exposure. So I think often a lot of people think, I'm low in vitamin D, I can just take vitamin D. Okay, that's going to be better than being depleted. But it's not the same as getting sunlight exposure.
I'm laughing because I was at my dermatologist a couple of weeks ago, and she said, you're not absorbing vitamin D from the sun. You need a supplement. And I was like, 100% I'm absorbing vitamin D from the sun.
I'm just not going in the sun enough.
But she never tested it. She was telling me, you're not absorbing enough from, and I said, I 100% am absorbing vitamin D from the sun. And then she said, and I said, I don't want to talk about it because that's science. Well, when I go in the sun, I'm absorbing vitamin D, and you're saying it's better than a supplement.
100%.
And we are almost told now that a supplement is better for vitamin D than the sun.
No, that's just completely unscientific.
But the fear of it's much more in the West, but the fear of skin cancer is always lurking, so that's...
Yeah, and I think the issue here is it's a controversial area, because actually, if you look at some of the observational studies, there are higher incidence of skin cancer and other cancers in people who have the lowest sun exposure. And I think you have to differentiate between healthy sun exposure and people who burn. And with the advent of sun protection, skin creams, etc., we've actually seen an increase in skin cancer rates. That's probably twofold. One is that, you know, with a lot of these skin creams, you're just absorbing the, you're still absorbing some of the bad spectrum of light, the UVA,
Okay.
whereas you're filtering out a lot of the good spectrum of light. The other thing is, if you're wearing cream, you're more likely to stay in the sun and burn. So
Okay.
it's about getting a healthy level of sun exposure, not just taking yourself out of the sun completely.
I have wondered, because I've heard and read that, and I wondered if it was because it's blocking the sun and you're not getting vitamin D if you're putting that
Completely,
cream.
yeah, exactly.
That's part of the
Yeah,
reason.
Yeah.
And then you're also...
Yeah.
So just to stay on immunization for a little while before we meander into all sorts of things. Now that we're out of all that and we're sort of back to a normal vaccination landscape, where do you sit? What are people asking you? What are people's concerns?
Yeah, I mean, it's kind of naturally put it on the radar. So then, you know, I always get a lot of parents coming to me asking me about kids' vaccination schedules. And, you know, again, it's something that people will have an opinion on. It's very difficult to give a scientific kind of answer to kind of, if someone has a mindset where they're not sure about giving their child the vaccines, it's very difficult to support that. I'm not saying that it's wrong, but it's very difficult to support it because I haven't got the science to say, oh yeah, actually you should omit that and that, and you should spread the schedule out. But what I can say is that the schedule has been, you know, under the sort of scientific rigor for years and years, and has been designed in a certain way that is supposedly safe. Now, just because it's deemed safe doesn't mean that there aren't going to be people who have complications. We fully acknowledge that there's going to be people who have complications from vaccines. No one's hiding that. But then it's a trade-off. It's a risk-benefit. So on a population level, the likelihood is that vaccine is going to have a greater chance of protecting you from the downside of that infection versus the risk of you getting a complication. I think beyond that, you know, I do often wonder whether the schedule is designed in a way to compress the vaccines within the first year of life from a compliance perspective, because, you know, during that first year of life, the mother's, you know, with the child pretty much all the time or most of the time, they're more likely to comply and go back and forth to the doctor. That's just me thinking out aloud. I can't say whether that's the reason why it's been designed in that way. But I guess the intention is also there to get people protected as early as possible.
Now, before COVID, the vaccine issue was parents who said the vaccine caused my child to become autistic. I saw they were fine, and then they had you hear these stories. They were fine, then they had the last vaccine, and then they changed immediately. And we've talked about this before, your theories about that and what you did with your own kids, like how you prepared for this, what's going on. Can you sort of just explain?
Yeah, and it was predominantly the association of MMR with autism, and I think the issue that movement had was that a lot of the original research that a guy called Andrew Wakefield, pediatric gastroenterologist, you know, the research he did, it was a paper, I think he had 12 kids, they basically realized it was all fraudulent. You know, but the thing here is that, you know, absence of evidence isn't evidence of absence. So just because we haven't proven something doesn't mean that it doesn't exist. Now, I think autism is very complex. It undoubtedly has a significant environmental trigger to it, and I see it, you know, week in, week out, in that, you know, when we're working with kids, cellular function and gut health and, you know, food, we see improvements and vice versa. When they don't comply, we see a deterioration. So there is a huge environmental component. What it is in our environment is very difficult to say. I mean, anything potentially that's putting stress on the system, toxins, you know, a lot of refined food. We've heard about pesticides, heavy metals. I think the likelihood is that these are all pieces of the jigsaw puzzle. And the problem is that I don't think you're ever going to have the level of evidence that the medical system requires that will prove or disprove it. Or certainly disprove it in my eyes, because they will say it's been disproven because the evidence doesn't exist.
Right.
But I see a different way. It still may exist. It's just we haven't, you know, the level of rigor that we require it to be upholden to, which I don't necessarily agree with. I think, there's nothing wrong with having a scientific theory that mechanistically makes more sense than our current understanding of something.
But you see this all the time in your practice. Like, there's things that maybe aren't necessarily proven in science because you see people having...
I mean, a lot of what we do in our practice, mainstream doctors will say is just witchcraft, or it's, well, what are you doing? It's rubbish.
Improving symptoms in kids with autism, for example, through diet and exercise. Some people would say that's impossible. Still.
Yeah, exactly.
Well, this is why you left the needs. This is why you became a functional person. When I think about autism, it makes me think about dementia, because when I think of all the reasons that go into autism, and the rates of dementia are going to supposedly set to skyrocket, explode across the world, but this region like phenomenally. And I sat down the other day and looked for studies of everything I could literally think of, and they were all linked to dementia. Yeah. Like I was just like, okay, what about toxins? Okay, what about loneliness? What about this? What about that? Like all of it's so difficult to talk about because all of the things we're talking about have it seems like they just have dozens of reasons.
So what you're seeing is basically these are spectrums of disorders. So, the way the health system has developed and the way that the science is applied to sort of testing a lot of these outcomes is that it's from an age where the outcomes were a lot more binary. So you would have an infection, you give an antibiotic, it either works or it doesn't work. But the problem is now with these lifestyle conditions, there's so many variables that either you have a blind spot to, that you just aren't even on your radar when they're doing the research, or you just can't control for it. But also because the root cause is different for your dementia compared to mine, it's difficult to tease out. But again, I think the issue with the way that we're treating dementia now is that everyone's looking at the plaques. How can we get rid of the plaques? It's a little bit like cardiovascular disease. I mean, all the focus was on the cholesterol, when the kind of cholesterol and the plaques are just the kind of innocent bystander. They're what's trying to protect the inflammatory process, right? Whether it be in the brain or in the vessel in the heart.
That's what the body's producing to try and prevent the inflammation. It's
Whereas we need to be looking at the environmental factors that are leading to that inflammation and damage in the brain.
Okay. I'm curious because it seemed like we switched straight from just back to immunizations for a minute. We switched straight from immunizations to the flu shot, and then we stopped talking about COVID vaccines immediately, and then it was back to the flu shot.
I'm sure there'll be some questions about that.
Yeah, we'll have some questions. But it was straight back to the flu shot, which I don't know. What's your take on the flu shot? Do you feel comfortable?
I think if you're in a high risk group, I mean, there's enough evidence there, but I don't necessarily. It's a personal choice. I don't necessarily think you're being cavalier by not having the flu jab if you've not got any health issues. I'm a firm believer in, again, the numbers. If you look at the statistics of the kind of severe sort of hospital admissions and severe health outcomes from catching the flu in a healthy individual, that risk for me isn't high enough. It may be higher for someone else and they want to take the vaccine. But I can guarantee you that most physicians will not share that information because they don't know themselves, and most people before they go for a vaccine won't have that information. It's like anything. It's like if I'm going to put someone on a statin, my client needs to understand, well, what's the risk benefit? What's the numbers needed to treat? Doctors never share that information with people, and then the people themselves aren't going to go and research it because it's just not on the radar to think of it.
And then you're in front of your doctor, you're just only hearing about the benefit, really.
Yeah.
The potential benefit. You're not.
Or it's like, why are you even asking me? It's just, you're told to do it, just do it.
Yeah, but I also, so many people look. It's interesting because you've been to medical school, you have so much more knowledge, and you are to be respected. But sometimes I think people have a bit too much. I just think sometimes people put a little bit. They put a lot too much stock in their one doctor as sort of like they're without taking some personal responsibility. How do you sort of?
It's shifted though, and I think in a good way. It's definitely become more challenging for the physician because there's so much more information out there in a good way. as long as you know how to navigate it. And people are a lot more empowered and knowledgeable. And I actually think they have to learn these things, because the majority of what people are suffering with now are lifestyle conditions that, as you said, aren't taught in medical school, and still isn't taught in medical school. It's not part of postgraduate education. So if your doctor doesn't know it, you're going to have to learn about it.
Yeah.
And I think also as well, if you challenge your doctor, which you should, and they get defensive, then you're not seeing the right person. I mean, I'm not saying I know everything. Yeah. I'm learning every day, but I'm honest. If a client comes to me and they've read something, and it's just something not on my kind of rate, I'm not going to know everything. Yeah. I'll just say, listen, I don't know, but I'll find out and I'll get back to you.
I don't think you have a defensive bone in your body about that.
Not yet. No. Maybe with age it might change.
Do you guys have questions? Do you want to ask Dr. Nasr some things? I mean, here's your chance to get some insight. I see a hand. Yeah. Yeah, we had some gut issues in the...
Yeah, so I think there's probably all of us at some point in our lives will experience bloating or discomfort or a change in our bowels, and even more so sort of now. I'd say that probably it's about half of what I see actually, whether it be directly someone coming with a gut issue or a kind of problem which at the root involves the gut to a significant degree. It's interesting because there's obviously been a lot of talk in the last, say, 10, 15 years about gut health. A lot of that's come about because of our kind of understanding of the gut has transformed because of PCR and our ability to kind of see our microbiome to some degree, which has kind of revolutionized the way we certainly treat a lot of these lifestyle sort of gut issues. The problem is, though, we are still in the infancy of gut health. So whilst we're a lot better at managing it, I think we've still got a long way to go. So, whilst we are, say, using very specific interventions like certain prebiotics or probiotics or other sort of concoctions, I still think that we're not at that point yet where, we're formulating these sorts of interventions to that sort of individual, because there's no one perfect gut or microbiome. It's very individualized. And so I think that's also going to be a big challenge. Cardiovascular disease is very simple. I mean, it's black and white. You've got certain metrics that you can measure. There's targets. We know the outcomes. Gut is just a whole different minefield. Although it's not. It can be simplified, and it comes back to kind of lifestyle, your nutrition. Stress is a big component to gut. So you often find with these things, whilst we don't have all the answers, if you go back to the same principles, whether it be your immune system or your gut, you'll tend to find that it will fall back in line.
You said half of people ends up being their gut.
I think what I'm seeing, yeah.
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 And then does that sort of feed into other...
Yeah, exactly. So whether that person comes with fatigue, brain fog, weight issues, gut will have some involvement. So we're often doing testing focused on that. Okay.
What do you do? Like GI mapping, or do you...
Yeah, so often kind of doing more comprehensive analysis of the gut. So, if someone goes to, say, a gastroenterologist, the gastroenterologists are great at diagnosing traditional disease. So seeing things that they can see with the naked eye, whether it be, cancer, inflammatory bowel disease, a blood test for celiac. But once you've kind of eliminated that group of conditions, you're then left with the kind of lifestyle gut issues which the testing isn't set up to handle very well. And that's the sort of test that we're utilizing.
Okay.
You often find that it takes about 10, 15 years for the most kind of up-to-date testing and evidence and research to actually infiltrate medical practice.
I think there's even been a study. I think there was a study that said it was like 15 to 17 years, which is crazy. So you're sitting in front of the doctor and you're putting yourself back in time.
Yeah.
Anyone else? I can keep asking Dr. Nasr questions all day, but I'd like to hear some.
I have a question, and I really find that you were saying about the flu vaccine and vaccination in general fascinating. But I couldn't agree more. About, as a healthy individual, right? From a flu standpoint, taking your chances as it were. But what about if a healthy individual takes the flu vaccine repeatedly? Does that equally a bad thing, for example?
It's not a bad thing, but I guess the point worth making is that there's this sort of stance that if you're developing immunity naturally, your body is adapting differently. So there was a lot of talk about antibody testing during COVID. What are my antibodies? We went through a phase where we had like 10 people a day coming in. Oh, I want to know my immunity. I think there was a couple of things there. I mean, immunity isn't just based on your antibody production. There's a huge cellular component to it that you get from a natural infection that you're not getting from the vaccine. So I think it's more weighing up the risk of what's the downside of not having it, plus if I do get it, I'm probably going to develop better immunity with a very low risk of something serious happening. I think it's more that thought process. As for having repeated flu vaccines, yeah, I mean, I don't know. I can't tell you what is there going to be some people who say that, and do I see people who say, I've had these vaccines and it caused this? I think in reality it's probably a bit more complex than that, but it's a theory, for sure.
Fascinating, thank you.
Yeah, all right.
I have to get help.
Yeah.
More asking an advice than just asking a question. What things and practices everyone should do, or you can advise us to maintain a healthy gut? I would say the microbiome, the bacteria, how we can maintain it.
Yeah, so I think there's two groups of people. There's people who are currently not symptomatic, so generally feel well in themselves, and then you have people who have an issue like what we were sort of talking about, where there may be an underlying issue like a microbial imbalance or a problem with the gut barrier function. The advice that you give to those groups of people will be very different, and so there'll be some people who sat in this room who and I've seen some of these people, when you ask them what are the certain foods which bloat you or cause problems, and they'll be like yes, and it'll be a lot of the healthy foods or foods that we would traditionally recommend as part of a let's say unrefined Mediterranean diet, but it gives them issues. It's not that food is innately unhealthy, but it's got things in it that are creating the symptomology, and until you address that gut microbiome, they're going to find it difficult to tolerate that sort of food. So if we shift back to the people who are already healthy, I think the evidence seems to suggest again, a predominantly plant-based, not fully plant-based, predominantly plant-based, unrefined diet, with obviously, Mediterranean essentially, but I think the important thing is improving diversity of the plant-based foods to improve the diversity of your microbiome ultimately, and keeping out a lot of the processed man-made foods. I think that's probably the simplest way of portraying the advice, really. Some intermittent fasting or time-restricted eating, but again, that's a slippery slope because there's a lot of people who can't do that, again, because of certain hormonal issues. But again, if we're focusing on a healthy individual, time-restricted eating, unrefined Mediterranean diet, managed stress, sleep optimization, because there's a huge stress component to gut issues. So you can throw all the gut interventions at someone you want, but if they still have that boss that they hate, or they're not sleeping because they've got a young child, their gut's probably not going to be in a great state, or they're going to struggle to recover.
So on that note, would you recommend that like for example, a family member gets a gut issue, would you recommend we get this microbiome tested? Like you said, not every probiotic is good for everyone. So get it tested, and based on that, to know what we need and what we need to avoid.
So I think probably very difficult to sort of generalize, but I think, first of all, the first step would be to see a practitioner who's experienced in dealing with those sorts of issues, and then whether that test is appropriate, then they can employ it and then give you a sort of management plan based on that. But what I can tell you what I typically see. So I see people who've already seen 1 or 2 or 3 gastroenterologists, and they've run the same tests, and they come to me saying all my tests are normal, but I've still got issues, it's not in my head, and I don't want to live with this the rest of my life. Then usually they're the sorts of people that we're doing this sort of testing. Yeah.
one family get gut issue, it looks like all the family members will get
Yeah.
gut issue.
So that often that's similar lifestyle. So whether it be the similar nutrition or stress or something else going on.
Would you recommend that even in a relationship, when you pick your boyfriend and girlfriend, check your microbiome in advance of
I don't think we can go that granular yet.
It's hard enough
Yeah.
to meet someone.
Yeah. I'm not sure how that would go down.
Yeah.
Submitting a stool sample on your first date.
On Tinder, you have to
Yeah.
put your microbiome
Yeah.
file. Yeah, it's still. Oh my gosh.
The link between nutrition, fibroids, and anything in the woman reproductive system. Because I cannot thank you enough how I thought I was eating healthy, which I do, but my body wasn't able to detox until Dr. Nas found that I wasn't able to detox estrogen. And without being on a pill of hormones, he managed to fix my problem here. But can you talk more about how certain foods might be making your fibroids grow?
Yeah, so for people who don't know, fibroids are benign sort of growth of the uterus, and a large component of that is hormonally activated, and estrogen is that kind of main hormone. And there often are people who, whether it be through lifestyle or actually a genetic predisposition to not detoxifying very well, they get an accumulation of estrogen, and the estrogen the metabolized sort of estrogen products, which then lead to the growth in fibroids. So in those people where you suspect there is a genetic tendency, which you can actually test for, there are you can either make sure that the diet is very rich in predominantly a lot of leafy greens, because these have components in them which help with the detoxification, or you can actually get them in supplement form. And then kind of looking at the diet and lifestyle, which may be also increasing estrogen. I mean, you may have heard of a lot of sort of chemicals, and I know you've read about this in the environment, that are kind of mimicking estrogen in the body. I think there's a lot of cosmetics.
There's just a brand new study that phthalates, with the P, the silent P, phthalates are contributing to the growth of fibroids, because there has to be something. I mean, people are having fibroids, getting them removed, getting more fibroids.
Yeah, plastic, cosmetics.
There has to be something. I mean, they've studied it, but there was just a new study about it.
So living like a nun, basically.
Yeah, putting nothing on your body. What about men? Because I have another platform where I talk about perimenopause and menopause, but I'm going to expand it to the male hormonal experience, because men in their 40s are not okay either a lot of the time. There's like a lot going on, and it's similar. It's brain fog, it's sleep problems, it's sometimes even hot flashes. Like, we've talked a little bit about low testosterone or whatever, but what are you seeing in...
I could tell you what I'm seeing. I'm working in Dubai, so I think probably every guy's now jacked on testosterone,
Right.
whether they've got a low testosterone or not. But no, jokes aside, I think it's underappreciated, under-recognized. As you said, we've spoken about this. I think the key difference between women and men is that menopause is a very quick drop-off in hormones usually, so it's quite a quick change, or certainly over usually a few months. Whereas men, it's a gradual decline from kind of mid-30s onwards. So it's a lot more subtle in terms of the symptomology, but epidemic. Like pretty much, yeah.
And mood too, right? Like depression, anxiety, all those things.
Yeah, it can, all these different mental or physical symptomology can stem from it.
Yeah.
I mean, I can even talk from a personal perspective.
Please do.
Yeah. No, as in just that, I had low testosterone, and it was causing me sleep disruption, fatigue.
Okay.
No motivation to exercise.
How long did it take you to sort of put two and two together?
I think the problem with myself is that I'm too busy dealing with other people's problems. It's like anything.
Yeah.
When you've got a family, you look after your family. You don't consider your own health. So it's just because I'm a doctor, it's no different.
Yeah.
So yeah, probably just when I thought it got to the point where I was like, I've just got to address this, I started shooting.
You started what? Shooting up?
Injecting.
You're shooting.
Yeah. Not at the moment. I'm off it now.
It's like a cycle. It's like a cycling thing.
I just kind of thought I'd come off and normalized it.
Okay. And do you feel? Are you feeling like?
I
what
feel better
happens
now
then?
than I was before, and,
Yeah.
and when I was taking it, yeah, it's almost immediate. It was
Okay.
within a few days.
So you don't have to stay on it.
No, I mean, there's nuances to treatment, and again, it's an area that has to be very well managed because,
Yeah.
and also there's not many practitioners who are used to applying it because it's a lifestyle
Yeah.
issue. It's not a disease. It's not considered a disease.
Right.
It's aging.
Yeah.
So it's an area that's not, again, part of medical school, it's postgrad. It's very subspecialized, and you have to have big caseloads of people to really understand what's going on. I mean, it's interesting. I've got a client, literally, we're talking now every day, and he was under a professor of endocrinology in London, very well-to-do guy, flying around the world getting opinions. And the professors of endocrinology had no concept of, the fact that he could have this other hormonal imbalance as a result of his testosterone treatment. What happened was, because he was taking testosterone, his progesterone went down,
Right.
and he wasn't sleeping because his progesterone was low. But because it's just not an area that's been studied or
Right.
taught, so it's not, unless you've treated a lot of people,
Yeah.
it's not something that you would recognize or treat.
Well, I even find in the women's space, everyone's focused on estrogen. Like people don't pay enough attention to progesterone. It's like even among the hormones, they're not treated. And in women, I think women actually make more testosterone than estrogen and progesterone. They're just compared in different units.
Yeah.
So that to me is weird. If we make more testosterone, why is everyone so obsessed with estrogen?
Well, and a key point as well is a lot of women are told, oh, you don't need to take the progesterone. If you're taking HRT, just take the estrogen. You don't need to take the progesterone because you've not got a uterus. Because the whole reason, or the traditional reason for taking the progesterone was to protect against cancers in the uterus. But the point being is that progesterone has a systemic effect way beyond the uterus. And that's, you're right, that's still something that's touted by specialists today.
And men have progesterone, and you need
Yeah.
and progesterone. What is mood and sleep? And
Yeah, I mean, if you're shutting down your natural testicular production of hormones with the testosterone therapy, then you're naturally going to be suppressing not just testosterone,
Right.
DHEA, pregnenolone, progesterone.
Since you mentioned pregnenolone, I'm really interested because that has quite something to do with dementia, does it not?
It's protective against dementia, yeah.
Do you
Yeah.
test for pregnenolone?
Not really, because there's not really any sort of guidance on reference ranges. It's just an intervention that we would try.
Most of what I've learned about pregnenolone comes from TikTok.
Yeah,
There's
I
an
mean-
anti-dementia guy on TikTok who says you got to test for pregnenolone.
But the funny thing is, actually, we were talking earlier about kind of trusted sources. With a lot of this area, you actually get some great information on things like Reddit. Because there are people on there who, again, are kind of applying a lot of this stuff in an underground way, but they have volumes of people that they're dealing with.
Right.
Or there's just people on there who just spent their lifetime studying it. That if you were kind of to do that research yourself, it'd just be almost impossible unless you were obsessive. So it's that paradox. Often you have to go to alternative sources to get the information.
When you say like obsessive, like I do see, because I'm in this wellness sphere, I feel like there are people who have some sort of approaching a disorder that is, I don't know what the disorder is, but it's like I want perfect health disorder. Like I need absolutely perfect health, and I'm going to test myself incessantly, and everything has to be.
We see a lot of those.
Yeah, like how you know what I'm talking about. This is a.
I
don't think
listen,
it's
I think
it's-
there's a good and there's a bad side to it. I mean, there's obviously now, there's people who have the time and resources to be able to throw the kitchen sink at it, and that's great if you're able to do that. But there's certainly a lot of people who I think, become obsessive, but don't put any value on their time and the kind of trade-off of, well, okay, you're going to go and do a infrared sauna 6 days a week for an hour a day, but it's like, well, what's the return on that versus if you actually just stopped eating, white bread. I'm just giving a stupid
Simple,
example. Again, I think people often don't weigh up what the return is on their investment.
Yeah. You could literally spend your entire day trying to be
A biohack, basically.
biohacker. Yeah. You're a biohacker though. A little.
I wouldn't name myself a biohacker. Well, it depends what you mean by biohacker, but I'll try things that probably aren't considered mainstream.
I've seen you get in a nice bath.
Yeah, okay, fair enough. If that makes me a biohacker, yeah.
The weirdest thing I've heard lately, and I feel like this has made my head blow up about nutrition, is that some of the vegetables that we've been eating a lot of actually are not good for us because some vegetables have toxins on them that make people not want, like they're like protecting themselves with toxins. Do you know what I'm talking about? This is like
Yeah, so you're kind of getting onto this sort of lectin type theory.
This is where I've gotten so confused.
Yeah, but I again, if anyone gives you a kind of just straight up sort of absolute answer to that, they're often, well, they're going to be wrong. It's like anything, there's a lot of nuances to it. It ultimately comes down to the dosage. And so, eating them, if you have a healthy gut, eating these foods in a regular quantity is not going to cause a problem for you in general. And if anything, the kind of the lectin content or whatever the protein is in there that you're not digesting may even have what we call a hormetic effect. So actually, it's a minor stress that improves your gut resilience.
Okay.
So there's no straight answer to that. But also, it's part of the reason why a lot of ancestral preparation techniques came about with some of these foods. I mean, we find these things out intuitively. Ancestrally, we didn't have any tests, but we knew, for example, if we ate, I don't know, aubergines in large quantity, or tomatoes, for example, in large quantity, some people would have issues with that, and that's why they often would de-skin a lot of these things, or they would ferment, or you sprout certain foods. So, and that's an important point, actually, maybe a good one. I don't know how much time we have to end on. In that, a key part of health is that a lot of people have lost that connection to their body and their intuition. We also do a lot of weight loss, and people say to me, "Oh, how many calories should I be eating? Surely I need to be weighing my food." It's like, no. More than 2 generations ago, everyone was skinny, and no one knew what a calorie was. Just eat the right food, eat to satisfaction. The reason we get hunger is it's our brain telling us that we're not getting enough fuel, and if you don't get enough fuel, your body will compensate, and your metabolism will slow down, etc., etc. So the point I'm trying to make is we need to just do things more intuitively and get in touch with our body.
Okay. Anyone else have any other questions?
Can you please more talk about eating intuitively? Because sometimes eating versus you don't get enough hydration, you also get hungry.
Yeah.
So this is sometimes confusing.
Yeah, true. And so, again, there's not always absolutes with these things, as I said. So, of course, you've got to make sure that you're not dehydrated. I think another key component that obviously affects a lot of people's hunger is stress. So, you've got to also consider these things. So I was kind of being generalistic. But also that it feeds into that, the same thing in a way, because you're in touch with the fact that you're stressed, or that you may be dehydrated. So it's all these different senses you need to be in touch with, not just hunger.
Nice. Isa and I were just talking about that this morning. Isa from Livehealthy, we were talking about how, like, realizing that stress can upset your stomach, and realizing that maybe you don't have an upset stomach. There's just something happening later today that you're nervous about, and just giving yourself some time to realize, and then realizing a couple hours later that there's nothing wrong with you, and you're not coming down with something.
Yeah.
Okay. Well, thank you so much.
Thank you.
Always
Thanks,
a pleasure.
Cheers.
Thanks, guys.
Thank you, everyone. Cheers.